Reports from South Korea, China and Italy have identified significant numbers of COVID-19 patients who have developed a loss of smell and taste. Researchers have since found the virus affects the brain and nervous system in some patients and may indicate which ones are at a higher risk of developing a severe illness. For more, I'm joined by Associate Professor Jenny Ekberg, who's a neurophysiologist at the Menzies Health Institute at Griffith University. Thank you so much for your time tonight. What do we know about the impact on the brain of people who have recovered from COVID-19?
Thank you very much. So a recent study just came out of China of approximately just over 200 people, and in those cases over 35% had neurological symptoms suggesting that the virus had reached their brain or other parts of their nervous system.
And so what were the symptoms?
So they had seizures, stroke, loss of sense of smell, loss of taste, and problems with skeletal muscles. And all those things suggest that the brain or nervous system was affected. There's also a lot of cases that have had headache or dizziness, which may not necessarily prove that it's brain infection, but it suggests that the nervous system is involved.
Do we know why people with COVID-19 lose their sense of smell and taste?
So we don't know exactly the mechanisms why this happens, but one way that it could happen is that the virus infects through the nasal cavity the nerve that mediates the sense of smell, which is called the olfactory nerve. And it may temporarily destroy this nerve, so the nerve cells are dying, but the lucky thing about this nerve is that it constantly regenerates, so the loss of smell is unlikely to be permanent.
I wanted to ask about that. How serious is it if people lose that sense of taste and smell?
So it's serious in the sense that loss of sense of smell causes you a lot of distress in your life, and it's actually linked to depression. However, in this particular case, because the nerve regenerates, it's very unlikely that it becomes permanent. The most likely thing to happen is that you lose your sense of smell and taste, and then it comes back after a couple of months.
What about some of those other symptoms that sound a lot more serious, the hallucinations, seizures, brain inflammation?
Yes, that would happen if the virus gets from the peripheral nervous system, so from nerves all the way into the brain, into the central nervous system. And there's one more very serious thing that could potentially happen, and that is if the virus reaches the bottom of the brain, called the brain stem, because that's where breathing is controlled. And if the brainstem gets infected, which has been suggested to potentially happen, you could lose your control of breathing very, very quickly, and that could contribute to why people can't breathe.
So when will you know the long-term impacts of COVID-19 on people who have recovered? We're talking about years and years, aren't we?
Yes, it would be a long time. I think that in the terms of sense of smell, if it's the peripheral nerves that are affected, it will come back and everything will be okay. But we don't really know what happens when the virus gets into the brain, into the central nervous system. So it's hard to say.
Because there could be the potential for people to develop, say, Alzheimer's or Parkinson's?
There is a link, established link in the literature between microorganisms, viruses and bacteria, and neurodegenerative diseases such as Alzheimer's and Parkinson's disease. But in the case of COVID-19, we don't know. It's such a long way away that I feel that if I had this myself, you cannot worry too much. We don't know what's going to happen.
Yeah, because I wanted to ask you about what we know so far about the neurological impacts from COVID-19 compared to other viruses like SARS or MERS.
We don't know. It's too early to say. All we can say is that it looks at this point like a significant percentage of cases do have a nervous system involvement.
What else are you looking at in this space? Are you looking at potential treatments?
Well, for example, our laboratory, we don't currently have funding for this, but we are hoping to maybe investigate new drugs that can stimulate cells in the brain or cells in the peripheral nerves to destroy the virus. But the thing is also there is something called a cytokine storm, which is a dramatic inflammatory response, which can happen in the body, but also potentially inside the brain. And that's something else that is dangerous. That we are also looking for drugs that could manipulate that response and calm it down.
Okay, so how much money are you talking about that you need for this research, and how long would it take?
It's very difficult to say exactly how much. Anything is better than nothing. If we got, $50,000, we could start it, for example, but in reality it would be for one person to work on this for 3 years would be a few $100,000.
Okay, Associate Professor Jenny Ekberg, really fascinating to talk to you tonight. Thanks for your time.
Thank you very much.